Hi, the collecting objective data in assessing the neurologic system is first gather the equipment, gloves, pencil, paper, cotton tipped applicator, paper clip, pen light, sterile cotton ball, substance to smell and taste, tongue blade, tuning fork, tape measure, cotton balls, objects to feel like toothpick, bottle for hot and cold water, tuning fork, low pitch, and reflex hammer. So, second is demonstrate courtesy, explain procedure to the client, and then do hand hiding. And then ask the client to put on a gown, and then provide privacy. So first, we're going to ask the patient about her or his mental status, like assess level of consciousness, like mangutana tag questions about the person, the place, time, and situation. So, to ask about the person, ask, pwede na mo i-ask ilang pangalan, ilang mother's name, or any other relative's name kung makarecognize ba ang client. And ask if they know where they are for the place, and ask for the time, kung unsang oras karon, or the time na imo siyang i-assess, and their current situation. So, next is observe appearance and behavior if the client. So, for observing appearance and behavior, observe nimo kung dress is appropriate, if the client's effect is appropriate, ang iyabang facial expression is appropriate. And next is observe mood, feelings, and expression. So, this time, try to ask questions. So, no, importante kayo, there should be a screening where you apply the client the depression screening and the client's suicidal thoughts. So, i-try og ask mong patient kung naka-feel ba siya og emptiness out of nowhere, and naka-feel blue for no reasons, and na-try ba na to hurt him or herself before, or unhappy ba siya lately, or depressed. And then observe thought process and perception, and then observe cognitive ability. So, cranial nerves. Assess the see and olfactory. So, before testing the nerve function, ensure the patency of each nostril by including in, turn, and asking patient to sniff. So, magkuha ka og aromatic substance such as soap and coffee, and then let your patient close their eyes, and then katong substance while you're occluding the other side of the nose, imong ipasimot sa iya, ma-recognize ba niya ang smell, and then kung ma-recognize niya, next is cover the other part of the nostrils. Imo na pong i-test ang isa ka nostril niya. So, next is assess see and trigeminal, testing motor function. So, ask the client to clench their teeth. So, if ana niyo yung client, and then ipalpate nimo ang iyang temporal and then masseter muscles for contraction. So, imo yan, ipalpate nimo dali. Because dali imo ang temporal, and then dali ang masseter. So, imo na siya ipalpate dali by the pads of your fingers. Ana. So, testing sensory function. So, tell the client to close eyes, then his or her forehead, head, cheeks, and chin with sharp or dull side of the paper clip. And then tell the client if he or she feel a sharp or dull sensation, and then the side of sensation. So, pangutanong niyo yung client kung asa nakita ang na-feel. And then repeat test for light touch with cotton wisp. And then touch same areas and compare both bilaterally. And then next is assess the CN 7 facial, and then testing motor function, and then imong pangutanan nimong client to perform these movements. So, ipa-smile nimo siya, and then ipa-frown nimo siya with wrinkled forehead, and then pa-show teeth sana, and then puff out cheeks. So, paana ni mo client. And then next is forced lips. Forced lips, ipong paana. And then raise eyebrows. Paana ni mo. No. And then close eyes tightly with resistance. So, ana. So, for the testing sensory function, test taste on anterior 2/3 of tongue for sweet, sour, salty, bitter, and umami. So, kanida rin, 2/3 anterior sa tongue. And then, kuha kag kani moisten applicator sa salt, sugar, and then lemon. Then, imo ibutang sa iyang tongue. And then, ask the client kung ma-identify ba niya ang color. O wala pa niya na-identify, ibalik lang ang procedure para taman sa ma-feel niya ay ma-identify niya ang flavor. So, after that, tip of the tongue is sweet, side of the back and half of the tongue is sour, anterior sides of the tip of the tongue is salty, back of the tongue is bitter, any part of the tongue for umami, and then rinse the mouth with water between each taste. Next is to assess CN9 glossopharyngeal, CN10 vagus. So test motor function, ask the client to open the mouth wide and say ah while you use a tongue depressor. And then test the gag reflex by touching the posterior pharynx with the tongue depressor. So kaning kita mo ng uvula, kanang murag bell sa inyo ang butonlan. Kilid ana nadara ang imo ang posterior pharynx, so imo na siya i-touch atong tongue depressor. And then next is give the client a water to drink, and then also note the client's voice quality. Check po nimo yung ability to swallow. And then next is assess CN11 spinal accessory. Ask a client to shrug shoulders up against resistance to assess the trapezius muscle. So, ipaana nimo siya, ipa-shrug shoulder nimo siya. And then, while ikaw mag-push down ka para hatagan nimo pressure, and then i-resist sa nimo ang client ang iyang imo ang pressure ng ibutang. And then next is ask her or him to turn a head against resistance first to the right. So right, dari. Imo anaon yan cheeks, and then dapat maghatag siya og persa. And then next is to the left. Next is motor and cerebellar system. So, assess condition and movement of the muscles. Assess the size and symmetry of all muscle groups. And then, assess the strength and tone of all muscles group. So, ang muscle strength, upper extremities, says hand grip by crossing index and middle finger, and ask the patient, so imo ni hatag sa imong patient, and ipag-grip sa iya, then test nimo iyang hand grip. And then next is lower extremities. Have client raise leg against your hand. Apply as you apply resistance. So, may pataas yung tiil. And then apply ka o resist. Apply ka resistance. And then sa muscle tone, inspect and palpate muscle mass and tone upper and lower extremities in relaxed and contracted state. And next is evaluate gait and balance. Ask the client to walk naturally across the room. Note posture, freedom of movement, and symmetry, rhythm, and balance. So, yung gait is stride length. So, 12 to 14 inches distance. So, paana nimo. And then observe yung posture. And then next is base of support. 2 to 4 inches distance between the feet. So, and then, sa iyang balance, ask the client to walk heel to toe fashion sa tandem. So, ipaana nimo. So, iyang tiil, ana. Then, ana ang tiil. And then, ask the client to walk on heels. So, kaniyang calcaneus Dari, muna siya ang heel sa imo ang tiil. And then sa toes, imo siya ana. Yung mga phalanges. And then stand close by in case kung ang client out of balance or in case the client loses balance. And then next is ask the client to stand on one foot and do deep knee bend. And ask the client to hop on one foot, repeat on the other foot. So next, assess coordination, accuracy of movements. Ask the client to extend and hold arms out to the side with eyes open. Then touch the tip of his nose, first with the right index finger and then with left index finger. Repeat 3 times. And then repeat these movements with eyes closed. And then next, assess rapid alternating movements or RAM. Have client perform finger thumb opposition and to increase speeds as it progresses. Ana. Sa kapaspason. And then ask the client to pat, tie, and one hand alternating with supination and pronation with speed increasing. Next is perform heel to shin test. Ask the client to lie down in supine position and to slide the heel of the right foot down the left shin. And then repeat put dimos the other heel and then shin. So next is sensory system. So assess light touch sensations. Ask the client to close both eyes, then try to touch with the light stimulus such as cotton wisp over the client's skin. So anana nimo ang cotton sa iya. And then torso and extremities and pangutanan ni mo client kung unsa ilang na feel. And then next is assess pain sensation. Stimulate skin with lightly sharp and dull ends of safety pin and paper clip. So apply stimuli randomly and ask client to identify whether sensation is sharp or dull. And then next is assess for temperature sensations. Touch client's chest and with test tube filled with cold or hot water. So imo din siyang ipa-feel sa imo ang client ug ma-identify ba niya to nga sensation kung hot or cold. Next is test by vibratory sensation. Place a tuning vibrating tuning fork. So itap nimo ang tuning fork and then i-apply nimo sa iyang distal radius, forefinger and medial malleolus and then the tip of great toe. And then pangutanan nimo imong client kung na-feel ba niya ang vibration o kanus to ni undang. So next is test position sensation or kinesthetic. Determine client's ability to perceive movement of extremities. Hold finger sides and up and move up and down. And have client identify direction of movement. And then flex and extend the client's big toe and ask the client to describe movement as up and down. And then next, test tactile discrimination. Fine touch, assess for stereognosis with client's eyes closed. Place a familiar object such as coin or a bottom in client's hands or a button in a client's hand and then ask client to identify it. So imong ibatang to ang kaning coin, imong ipa hold sa iya and buhaton pa ni siya the other side sa iyang hand. So magbutang ka tari coin, for example coin and dari button, then ipa-identify nimo unsa ni nga object and unsa ni nga object. And then next is test point of localization. Briefly touch a client to identify the point of touch. And then test for gravitia. The patient's eyes closed. Use a blunt instrument to write a number on the client's hand and ask client to identify the number. Repeat the other hand. So imong isulat diri while his or her eyes closed. And then kasi iya ang kamot. Hintayin magsulat kag 8 while their eyes are closed. and ask them kung unsa ang imo ang gisulat. Kung ila bang ma-identify. And then assess the 2-point discrimination. Determine on the fingertips, forearm, dorsal hands, back, and thighs. Ask the client to identify the number of points, 1 or 2, felt when touched with ECG calipers or ends of 2 toothpicks. So measure the distance between the 2 points when the client can no longer or distinguish the 2 points as separate. So test for sensory extinction. So simultaneously touch both sides of client's body at the same time. Ask the client to point. So imong siyang unitan dari, both sides. And then kung tanon nimo ang client kung asa siya dapit gigunitan. So for the deep tendon reflexes, so first is biceps reflex. Rest client's elbow in your non-dominant hand, so kani. And then with your thumb over bicep tendon, so kani diri. Strike your thumbnail kani imong non-dominant hand, yan ani mo. And then evaluate C5 and C6 so dari imo siyang magamit kag reflex hammer dayon imuning pa-relax imong kamot sa imong patient, let your patient's arm relax, and then imuning pukpuko ni diri while holding this area sa reflex hammer, and then see for any reactions. So next is triceps reflex. So ask the client to hang the arm freely, so ana limp like. Paana nimo imong client while you support the arm with your non-dominant hand and with the elbow flex, tap the tendon above kani the oculocrinian process, and then evaluate the spinal level C6, kaning 6, C7 and C8. So pukpukunin nimo siya dari over reflex hammer, and then see for any contraction. So pag pukpuk nimo na dali, naman na siya contraction. So next is brachioradialis reflex. Ask the client to flex elbow with a palm down and a hand resting on the abdomen, so ana or sa iyang lap, but since kita lang nag-apply yan so dali na kayo sa abdomen, and then tap the tendon at the radius above 2 in above the wrist. So kani mo ni mong radial imo siyang ikuan mga 2 inches sa mga ana, and then gamitan nimo siya og kaning reflex hammer, and then imo siyang dukdukon daring area briskly nanaon nimo, and then this evaluates the spinal level C5 and C6. So next is the patellar reflex. Have the client sit with legs dangling. Strike the tendon directly below patella. So kani. So mo ni patella. And then find the kneecap. So dari. And then i-extend ang feet. And then makita nimo ang tendon. And then for example kani ang ato ang reflex hammer, and then i-strike lang nato. Ana. And then evaluates the spinal level L2, L2, L4. And then next is the Achilles reflex. Have client's leg hanging, so dive kani ang tiil ipabitay nimo, and then dorsiflex the foot. So yan na nimo para once nga ma-dorsiflex na nimo siya, makita nimo ang tendon. And then with the flat side of the reflex hammer, itong likod niya, imo din siyang dukdukon. Naon nimo. And then evaluate the spinal level S1 and S2. So that concludes the assessment of the neurologic system. Thank you.